Welcome to the inaugural episode of Abacus Insights Health Planning, an executive discussion series focusing on the challenges and opportunities facing payers in this ever-dynamic healthcare environment. My name is Minal, Patel, and I'm thrilled to welcome as our first guest Dr. Reena Pande. Reena is an accomplished internist and cardiologist who over the last 10 years has spent her time focusing on the ever-important issue of behavioral health. Reena, welcome.
Thanks for having me. Such a pleasure to be here.
Tell me about how you got into the whole world of behavioral care and why is it such a passion for you?
As a cardiologist, we're thinking about behavior change, lifestyle change all the time, or well, we should be. I certainly was. And I found that I kept bumping up against these barriers with my patients. And it became very clear that how common mental health was the challenge that was keeping them from being able to do what I and they wanted to accomplish with their overall health.
How about contextualizing more broadly to the healthcare ecosystem? You think about the quintuple aim in healthcare, right? Cost, quality, experience, both member, provider, and in as equitable way as possible. What's the role of mental and behavioral health in that field?
A lot of things have changed over the last decade in mental health, right? I think there's been an increasing appreciation for how common it is and how costly it is when it goes unmet. As you know, the mental health needs have just continued to rise and rise and rise. The last several years and the pandemic and the rise of social media and its impact on our teens and the broader population has just made it much more of a crisis and much more of a need for us to be able to get good mental health care into the hands of those who need it today.
When you think about the payers that you've served over the last 10 plus years,
Sure.
And when you think about what's their opportunity, what's the message you give or were able to give in those roles to say their role and their opportunity in both investing in, reimbursing, and advocating for mental and behavioral health for their members?
Payers are in a really great position to be able to vet high quality solutions, help their members navigate to those solutions. And then I think they're going to have to be wiser about how they judge value. But I think we're going to be pushed to move from access alone as a focus to access plus quality and outcomes and the impact it has on patients and payers in terms of outcomes and cost.
What do you tell the payer or even the self-funded employer for that matter that says this is not a priority or it's something that is a priority, but I can't afford it or I can't get there?
I think payers and employers are always mindful of budget. I mean, to be blunt, cost matters. It just does. And so what we were able to convince our payer partners of and our employer partners of early days was you are missing out on an opportunity to reduce avoidable spend by not sufficiently addressing mental health needs. There is a population of people that are costly, they're complex, and if their behavioral health needs go unmet, they're costing you more money. So actually spending a little bit more money on mental health can be a driver of better, lower costs overall.
Pivoting to data, which is, again, the passion for what I get to think about every day. Data unto itself is meaningless unless you're tying it to some meaningful outcome. And in this case, talk about how what the role of having data is in support of the mission of having phenomenal behavioral and mental health.
I'll just reflect on what we did at AbleTo and then a little broader on the space. So we used, first of all, we used data to help identify people who might be in need. Think of a patient who just had a heart attack, who leaves the hospital, doesn't realize that depression or anxiety are really common in the wake of a major medical event of that nature. And so maybe they're short of breath, maybe they're having some palpitations. They may not know whether that's a cardiac symptom or whether that's something else altogether, like a mental health challenge. We were also using data to guide patients to the right intervention and then measuring so many elements of their care and their clinical outcomes so we could ensure they were getting the right treatment plan and then also that they were doing well clinically. And then finally, we were using data on the back end to demonstrate the value of the work to our payers. So tons of ways to use data wisely in service of getting the right care into the right patient's hands and demonstrating its benefit.
What advice do you give to payers that are looking at their medical spend or challenges with behavioral health and specifically with respect to data or even more broadly, what would you tell them?
It's a challenge to get data that's easy to access, that's clean, that you can manipulate. I mean, you guys know this all too well. So I think there have to be better systems in place to get easier access to that data.
That notion of bias and models and is actually extremely relevant in today's conversation around large language models and AI. So any comments on the use of these modern technologies, particularly when it comes to the sensitivities around behavioral health?
I think there's huge opportunity to use some of the more modern technologies, AI and large language models for mental health with the right guardrails and with the acknowledgement that there are limitations and we have to be thoughtful about how we use the data. There's also some really great ways to embed efficiencies. So there's still a lot of inefficiencies in the way clinicians are measured, how clinicians are taking their notes. And there's so many great ways to use data wisely to make clinicians' administrative work more efficient and effective.
Reena, thank you for your comments. Thoughtful as always. Really appreciate your dedication to not just behavioral mental health, but just healthcare in general. And to our audience, thank you for listening today, and hopefully you'll tune in for a future session.